Thank you very much, Dr. John. First of all, I would like to thank the organization committee of this conference for inviting me to come to this conference. And I would like also to thank Dr. Jah, who invited me to come. I must say that Dr. Jah has been involved in Jordan and the Middle East for the last 5 years in collaboration with our efforts, actually, to build not only cancer care, also palliative care in our region. His role actually has been recognized and appreciated. So thank you very much. Well, today I'm going to talk about palliative care in Jordan and to share with you my experience in this regard. Actually, I was thinking about that, and I think it's very much challenging to talk about palliative care in this meeting. We are talking all about oncology here, and I thought it will be very much useful to share with you this piece about our experience. To share you about that, we have 3 major points I would like to cover. First of all, I would like to give you an idea about what's going on as global perspective of palliative care. Then we talk about our experience in Jordan as a WHO demonstration project. And then I will move on to talk about role after we collaborate actually with international societies. It's maybe our role now to go ahead and to hold the torch and to say thank you for these people who actually help us to move ahead for the last 5 years. So first of all, this is the definition of palliative care as stated by WHO. It is the approach that improves the quality of life for patients and their families who is facing the problem associated with life-threatening illness through prevention and relief of suffering, taking into consideration ill identification and taking into consideration physical, psychological, and spiritual needs. First of all, I would like to ask all of you, we came from different countries. How many of you have palliative care service in their place? Okay, some of us had, some of us no. And we move on to the first step here. It talks about the movement or evaluation of palliative care as global perspective. Now we know that palliative care is not only limited for terminal ill patients. We know that all patients who have cancer, actually, they need palliative care, not only for pain and other physical issues, in addition to social, spiritual, and psychological needs. There are about 30 million people suffer from unnecessary pain and symptoms each year. In spite of all efforts which has been done for the last 2 decades, most people who need palliative care, actually, they don't get it. And there are 60 million people dying each year. 6 million of these people die from pain. Only 1 million of them have the chance to receive palliative care. And again, there are about 8,000 palliative care services in the world, in 100 countries. But it's unfortunately to see that most of these services actually are located in the developed world. Now, what is the solution for that? We know the problem. We know there is an issue going on. I was talking with Maril's from USAID in Cairo a couple of minutes ago, and she was wondering about the evolution of palliative care in developing countries. And my response was very simple. We are all talking about the Viva and World Cup nowadays, and we are following some matches. I would say that the real players of palliative care in Arabic countries or in developing countries are existing. There are so many wonderful people, physicians, other healthcare workers, decision makers, stockholders, but just like football playing, we need somebody to take them together. We need a coach. We need a real plan to move forward. Now, this is the plan. We understood and we learned from the last couple of years that we need something what we call a public healthcare approach to protect and improve health and equality of life of a community by translation new knowledge and the skills into action. And it is important for all countries to take the pain relief and palliative care into their healthcare system. That was clear for us, but again, there was many challenges. We learned that there are many countries in the world for the last 10 years has managed to take this knowledge and the skills into action, and we learned from their experience. We know that National Health Care Plan worked in Catalonia, Uganda, Mongolia, and Georgia, and it was very interesting experience. It's amazing how Kerala managed to do that. Kerala was one of the countries who adopted what we call it community-based palliative care, where they utilized a neighborhood system. Suresh Kumar was one among them. They managed to do that, and by neighborhood system, they did what we call it training of trainers. And unlike the developed countries, which started from the top, they started from the bottom by utilizing the community and volunteer work in their country. And in Catalonia, they used WHO demonstration project. It was the first to reach long-term outcomes. And 80% of these people who need palliative care was covered by this project. What about palliative care in Jordan? First of all, I would like to share about my country. This is where we see Jordan. It is located in the Middle East, right here. And if you go, if you have the chance to visit Jordan, this is Petra, and this is one of the world wonders nowadays. And here the Dead Sea, where you can have the experience of reading the newspaper while you are floating in the sea. Very interesting. Well, I would like to give you a brief idea about Jordan. This is the area, it's 92,000 kilometers. It has a population of 6.3 million people. It's a relatively new, small country, and it's young, relatively young population. 50% of them are young. And according to National Register Program, we have 4,332 new cancer patients each year. Unfortunately, most of them are at advanced stages. Since we are talking about breast cancer, I would like to share you some information about the breast in Jordan. Again, according to National Registry, it's about 674 females and 10 males who had cancer in 2005, accounting for 18% of total new cancer cases. The breast cancer is ranked #1 among females, accounting for 36.2% among female cancers. Again, 70% of these people are at stage 3 or 4. And this is emphasizing the importance of palliative care for these people. Well, from my experience, I can see that most, if not all, breast cancer patients, actually, they are in bad need for palliative care. We are talking about pain, about short of breath, about nausea and vomiting. What about the wound care? We are also experienced in wound care. It's very horrible to have such malignant wounds. We are talking about dignity, about the odor, about the discharge, about losing self-esteem. And that's very important to take these patients at early stages to give them the hope and the spirit they need.